Hello friends, I am Dr. Viswesvaran, currently working as a consultant, interventional pulmonology and sleep medicine specialist at Yashoda Hospitals, Somajiguda in Hyderabad. Self-medication with drugs is a serious concern that we observe amongst patients with respiratory conditions. We often see patients, irrespective of the age group, self-medicating with drugs for complaints like cough, breathlessness, fever, chest pain, loss of weight and loss of appetite. Taking these medications on your own, either by means of random search in the internet or from a non-competent authority, can lead you to the exposure to the adverse effects of these drugs and can also delay your diagnosis. For example, we have seen patients who has come to us with complaints of cough for which they have self-medicated themselves with the medications not from a pulmonologist or from a trained doctor but on their own, and later they turned out to be advanced lung cancer. So whenever you have an unexplained cough or you have an unexplained breathlessness or fever, loss of weight, loss of appetite or chest pain, these may be the early signs that you may be suffering from a serious health problem such as infections like tuberculosis or pneumonia, or sometimes it can be even the early symptom representing your underlying lung cancer. In addition to this, the presence of a chronic cough can also indicate some serious lung conditions like advanced COPD, interstitial lung disease, bronchiectasis or severe asthma. Rather than going into the particular diagnosis, if we start treating these symptoms with drugs which are available over the counter, it can lead to a delay in the diagnosis. For example, many of the lung cancers, if it can be picked up at a very early stage, it can be treated with a much better outcome. Unfortunately, what really happens is many of these patients have these early symptoms but they go unnoticed, they self-medicate, and by the time they come to us, they generally land up with stage 3 or stage 4 lung cancer where the survival becomes very less. Similarly, for tuberculosis, many of these patients generally present with cough, breathlessness, fever, loss of weight or loss of appetite or bleeding in cough. When these symptoms are there, you need to report to your pulmonologist at an early stage. If you don't take treatment at an early stage, these may be the symptoms which may be associated with a serious infection called tuberculosis. And once it is not diagnosed at an early stage, it can lead to the permanent scarring of your lungs and can make you suffer from long-term health problems. So identifying these symptoms early is of paramount importance, but what makes the difference is you should immediately consult your expert pulmonologist who can suggest you certain tests and can identify the disease much early and can provide you with a better treatment outcome. So with this, we need to understand that self-medication for any of the symptoms of the cough, breathlessness, fever, loss of weight, loss of appetite or bleeding in cough should not be a practice by anyone. And when you have these symptoms, do not resort to over-the-counter drugs. Get yourself evaluated by an expert pulmonologist so that you can pick up the disease at a much early stage, avoiding the side effects related to the delay in the diagnosis as well as exposing yourself to the adverse effects of these unauthorized medications. Thank you.